Hi, my name is Victoria. I'm thrilled that you decided to stop by my YouTube channel. Thank you for joining me. Today I'm going to be doing part 1 of the chronic illness tag. So I have all the questions written down. I wanted to do it in parts, this way it's not crazy long, hopefully. So this is just part 1, so keep a lookout for part 2 coming soon. What are you diagnosed with is the first question. So I've hit the chronic illness jackpot, I say, because I have so many different diseases, several of which are extremely rare. There are a couple that I have that are more well known, but the majority of them are rare, and that does complicate stuff. So my first two are autoimmune diseases. In an autoimmune disease, your immune system is really overactive and it does not behave properly. Instead of it attacking like bacteria or an infection or stuff that really shouldn't be there, it attacks you instead. So I have ulcerative colitis specifically, and colitis is just like Crohn's disease, except for it's the lower GI tract, but they're not just like Crohn's, but they're very, very similar. They have similar symptoms. Crohn's affects your mouth to your anus, and ulcerative colitis is the large intestine usually to the anus, so there's a little bit of a difference, but they are very similar. Treatment options are similar. So, and my other autoimmune is systemic lupus erythematosus, also just known as lupus, which in lupus, your immune system attacks literally everything. It's capable of attacking organs, your intestines, higher up in the GI. You lose hair. I mean, there's so many symptoms. It attacks your joints, heart. It can attack anything with lupus. Some people say that lupus is a bunch of autoimmune just rolled up into one. And there are about 80 or a little bit more autoimmune diseases that they have identified so far. Some other diseases they think could have an autoimmune component, but they're still working on getting that answer. And that leads me into my next disease, which could be autoimmune, but they're still researching it because it is more rare. So I have hypergenic postural orthostatic tachycardia syndrome, which is an insanely long name. So this includes high adrenaline, which is specifically the epinephrine, which, again, long words. This is just a form of dysautonomia. Basically, the autonomic nervous system does not work correctly. Your autonomic nervous system is responsible for all your involuntary movements and like breathing, blood pressure, heart rate, all that good stuff. So for me personally, with my POTS, I get dizzy quite frequently. I can pass out, and if I'm passing out, it's usually from low blood pressure and a very, very high heart rate. So the blood pressure will drop to about 70 or 60, the top number, and then 50 to 40, the bottom number. And my heart rate can go up to like 155 or a little bit higher. So it definitely scares some medical professionals when they see it, actually. So you have to really be educated and be able to explain what's going on to them. So my next disease is Ehlers-Danlos syndrome. I'm extremely hypermobile from this. It's a genetic connective tissue disorder, which is from a lack of collagen. I'm not going to go over all the symptoms because there are so many. It affects your entire body. It's another systemic illness. So, but we've discussed that I could have the hypermobile type and the classical type. There are several different types. I want to say at least 6, but I could definitely be wrong on that number. So the next one is mast cell activation syndrome. Mast cell is an immunological disorder where the mast cells are overactive and basically misbehave, and they release way too much histamine. So this is a lot of like allergy type stuff, pre-anaphylactic, anaphylactic. I never knew that I had been anaphylactic until I looked up the symptoms and we realized, hey, those breathing issues were not asthma. They're actually anaphylactic-like reactions. So I have a huge list of allergies and they're constantly changing. which definitely makes it a lot harder. I really walked around for years thinking everybody has this many allergies. They just don't know because they're not sick and they haven't been on medicine, so they just don't know they have tons of allergies, which isn't the case. But everybody does have mast cells in their body, which I wanted to point out. Mine just misbehave. So my next one is hereditary hemoglobin telangiectasia, which is extremely rare. We kind of accidentally found out about it. It was kind of one of those things that they were like, we're just going to run a bunch of genetic type tests and nothing's going to come out, so really don't worry about it. When they called to tell me I had it, they told me to Google it. Nobody was really sure what to say to me or really what to do. So in this disorder, your blood vessels are missing different components. You can also have AVMs, which are kind of like knots in the blood vessels. They can grow, they can become problematic, and they might need to be removed if they're huge. You can get them in your brain, your GI tract, around your heart, basically anywhere. So endometriosis is one of those diseases that you've likely heard of. There have been a lot of commercials about endometriosis lately, at least where I live. So endometriosis just means that you have tissue that's growing in the wrong spots. And for me personally, I also had a lot of cysts from before my monthly even started. So from the age of 9 up, I had so many cysts. I had one that was so big. I think it was like the size of like grapefruit or something. It was like huge. But the cyst was so big that I could have lost not only like my female organs, but also my bladder, which is kind of really important, but they missed it on all the tests, so we didn't know until I went in for surgery that there was this huge cyst that was leaking. Thankfully, it didn't break on its own because it was way too big. So the next few are kind of back-related. I'm just going to rattle them off just with a shorter description. So degenerative disc disease, which means that my discs are wearing out. I have narrowing of my spinal cord, bulging disc, herniated disc, and I am clearly crooked in the top of my back, which I attribute to EDS. I don't really know for a fact, but my arms are extremely uneven due to my back being so crooked, which children find funny. I have a lot of little friends and they're great. I also have adrenal insufficiency, which I know is really confusing when I say with the hyperpots that my adrenaline is high. So this was really confusing when I found out that I had this. So this one is the cortisone, which is kind of like prednisone that your body makes naturally. I don't make it. We're not really sure why. It could be due to steroids, but we're leaning more towards that it's autoimmune related. So, and I also have a growth on my right adrenal gland, which I have had apparently before on the left one, which I was completely unaware of. So next I have osteoporina, which is the beginning stages of osteoporosis. And no, it is not from steroids actually. Mine is from one of my diseases. They're not sure if it's from like an autoimmune or EDS really. We haven't really done much digging into it because there's so much always going on medically. So the next one I really don't know anything about. I found it in my chart. So it's a mutation of the gene GDF2. I'm going to assume that it doesn't really hold much weight and that they don't actually know why it's not working or what symptoms it causes because nobody's really talked to me about it. So, and then I also have a bunch of internal birth defects. If you saw my last video, I did mention having an extra kidney, which is fused together on my right side. So when you're looking at it from a CAT scan point of view, you actually can't tell that I have an extra kidney. It looks like one super large one instead of two. So they actually found it when they did a scope. But I also have 2 ureters, which is the tube that connects your kidney to your bladder, and they are twisted up together quite tightly. So that's another birth defect. I also have a debatable heart murmur. How it's debatable, I am unsure at this point, because to me, it should be pretty easy to say, hey, you have it or you don't. 24, and I really don't know if I have a heart murmur. But I do have mitral valve prolapse. I have 2 valves that are attached to one another in my heart that should be separate. I think I do have an extra valve somewhere. I also have a bone spur in my abdomen, which looks like they think an arm bone. And they also have a bone spur in my hip, and I also have extra vertebrae. So there is question about all my internal birth defects as I've gotten much older. If I had a twin and I was supposed to be maybe conjoint, that's my theory. Not that the doctors don't really care. They're just kind of there, the birth defects. But I also have permanent damage to my hip. I've torn cartilage pretty bad and other stuff from falling. I've also post at least 2 concussions. I feel like it's probably more though at this point. I'm just not remembering with my brain fog. I also have migraines, chronic kidney stones, random liver enzyme spikes. Your liver enzymes should be in the 30s. Mine go up to near 900. They have never really given me a reason why, but it's just something that I've dealt with. It's nearly killed me a couple times, but they don't really have much of a theory on that one. So, and then I also have an undiagnosed GI issue, which we're leaning towards gastroparesis at this point. I have one last test to go through. I'm so happy that it's just one. And then I should know for certain if it is gastroparesis, which gastroparesis, again, is pretty rare. And in gastroparesis, your stomach is basically paralyzed. It's a motility disorder. It could be caused from several of my diseases, but the cause doesn't really matter at the end of the day, you know. It's just a matter of what you can do to manage it. So, finally, question number 2. What do you tend to do at night when you can't sleep? I am an insomniac, completely. So if I don't take anything to help me sleep, I will be up all night and then be up basically all day. So I don't sleep without something. But if I'm still having trouble sleeping, which does happen, of course, in any chronic illness person that I know of, I'm usually on Pinterest, and with my cat Sadie, I will, pick her up, put her in the bed, and just pet her while I'm on Pinterest. What is the worst experience or side effect you've had from a medication? Like I said, I have mast cell activation syndrome. There are tons of reactions I've had, but 2 definitely stick out in my mind, which the one I'm not going to mention the name because a lot of people are on it and I don't want to freak people out. I was just way too young going on it, to be perfectly honest. I had GI issues and fake seizures and dizzy spells and a bunch of other side effects from it. So that was actually pretty scary. I locked myself in a bathroom stall and had a seizure at school, which, as a junior in high school is definitely not something that was great. It was quite not only nerve-wracking, but embarrassing at that age. Now I wouldn't care, but when you're a teenager, everything matters, right? So, and then the other one is Reclass, which is an osteoporosis medicine, that it's an infusion that I had gotten. I don't know if everything that I endured right after Reclass was strictly a reaction, but it definitely did start to spin things out of control for me. So when the day after I had Reclass, I had to go to the hospital because I wasn't able to eat, wasn't able to drink, couldn't really sit up. I was so dizzy. Everything spun nonstop. The pain was so excruciating. So we went to the ER and my liver enzymes were elevated for the first time. Like I said, I don't know what that's related to at all. And I had really high heart rate too and low blood pressure. The heart rate was so high that nurses were coming in the cardiac unit and waking me up and asking me why my heart rate was high. And I just honestly wanted to go back to sleep. I didn't understand why they kept asking me until I found out how high it really was. And just to clarify, any allergic reaction that I have because of the mast cell, it does tend to flare all diseases, so it is hard to tell which parts are reactions and then which parts are part of a flare-up. So those are all the questions I'm going to do for today. Be on the lookout for video number 2 on this, the chronic illness tag, and please subscribe and like and comment if you'd like, and I will see you in my next video.